Hello, everyone. I welcome you all again for joining me today for yet another lecture with the multiple lecture series with SNS Dental, where we are gathered here to learn about how to place single implants as a beginners. And so far, we have covered a lot of material. We started out with history, material science. We talked about the implant osseointegration, and we even talked about how to place surgical implants per se. Last time I started out with the prosthetic phase where we discussed the pre-prosthetics, basically the difference between the one stage versus two stage protocol and how to go about doing a second stage procedure, what things to take care when you are doing a second stage or implant exposure. Now we are assuming that we have done all of that correctly. We have placed our healing abutment. It's been enough healing time, and now we are ready to take impressions. So today's lecture is mainly about discussing various implant impression techniques and how to do those. Okay, so let's get started. We all know we are prosthodontists in some ways. We take impressions in our daily practices, be it crown and bridge or denture or diagnostics or whatever. And we are well aware about the materials that are available, and we pretty much use all of these materials in our daily routine practice by one way or the another. So the alginate impression materials, the elastomeric impression materials, and so forth. When it comes to implant impressions, the choice of material is elastomeric impression materials, because we all know and we have studied this in our second year, third year dental material science back in dental school. We were taught the dimensional accuracy and the perfection to detail, especially the marginal integrity. All that is better with elastomeric impressions than any other materials. So elastomeric impressions such as the additions reaction silicone, the polyethers, basically these are the material of choice for implants. Okay. And what are the armamentarium that you require? So first of all is, of course, you have a good impression material. You need to have good trays. Now trays, we all know they come in either they are metal trays or plastic trays. You can use either, okay, or both. You can have both in your supplies and use either or depending upon the case. You can even make custom trays, and I'll show you what custom trays look like. So you can either have a stock metal tray, a stock plastic tray, or a custom tray, and you need to have a good impression material which is dimensionally stable, which accurately records the implant or the abutment position. Okay, so once we have all that sorted out, then we'll move about learning about the components which are required for taking impression. Okay, so let's move ahead. I already discussed this with you, the chemistry. So according to the chemistry, as I said, the polysulfides, polysilicones, and polyethers are the choice of materials. According to viscosity, the materials can be divided into either light body, medium or regular body, heavy body, or very heavy, such as putty consistency. We all have done this wash and putty impressions in our crown and bridge practice, so we know what we are talking about. Now, when you decide, when it is your first time doing implant impressions, even though you know that there are conventions in C silicons and A silicons and polyethers, but you might not be aware of the brand names. So here, my goal is to just give you a few names, the brand of materials that are out there. Now, see, I don't prefer one over the other because most of the materials they come from standard companies. Okay, they have years of research behind it, so it's up to you to which brand of material you want to go with. But basically, you have to keep in mind that chemistry wise, they should fall into elastomeric impression materials for accurate impressions. Okay. So just to give you an idea, that doesn't mean that the impression materials are limited to these brands only. There are numerous brands available. But as long as you read the material, the details of the brand of the material, then you should be able to make out if this is polyether or polysulfide or silicons. Okay, so then you can make the judgment from there. Just few names to put forward here. When we're talking about the A silicons, Dentsply has something called Aquasil, which is putty as well as the light body material combination. Coltine has their products called Affins, and 3M has their product called imprint. So all of them are good materials. It's your choice. Now it comes in two formulas, like the previous one we showed you here. Sometimes it comes in in the heavy body material. It comes in the putty and the wash combination format. The medium body, it comes in the syringe format. So you can have the tools to dispense the material, because we all know that when it comes into the base and accelerator syringes, you have to make sure you follow the proper ratio to mix these materials. So there are materials out there which provide like the tube format, where you just push a rope of base and rope of catalyst according to the manufacturer's instruction. Then when you and then you hand mix it on a pad or something like a glass slab, or you can go for these kind of cartridges which are made in a dispenser gun, which has and these cartridges are pre-titrated. That means you don't have to worry about uh, taking out certain amount of base and certain amount of catalyst, because it is pre-mixed, it is pre-formed. You just put it in the gun and push the plunger, and it will pre-mix the material for you in the syringe before it is inserted out. So you can use this for convenience and for comfort. So you get the accurate amount of material every time. The only disadvantage with this kind of materials is a little bit of wastage that always happens in the syringes, and the additional expense of having a gun. But I look at it as a one-time expense, and you can use it for multiple purposes as well. Okay, so that said, 3M has come out with something called Pentamix, which is even a sophisticated device which has everything pre-mixed. So you just press the button. It is automated, so it's not manual. On just a finger touch, if the material is removed from its respective tubes, it is pre-mixed, and then you can load your tray directly. It's called Pentamix. Of course, it's very, very expensive, but it's great. The 3M has this dispensing system only for the polyether. Now, keep in mind, polyether usually is considered to be the best material out there for any implant or even any precise counter impressions. So as I showed you earlier, these were the examples of the A-silicons, which is Aquacel, Essence, or Imprint. And if you prefer the polyether, and these are the brand names, Impregum, which is from 3M, Permadyne, also 3M, Pentamix 3M, and Polygel from Dentsply. So 3M is big name when it comes to polyethers. These are all good materials. You can select from either of this. They're all good. Okay. So once you have a good material, you're all set. And as I said earlier, you can go with the stock plastic trays or stock steel trays. Now on this slide down here, you can see I've put a picture where a hole is being drilled through the tray. Okay, and why we need to do that? It is used for the open tray technique that we will learn as we move ahead. So if you are using an open tray technique for implant impressions, you cannot use the metal stock tray, because you don't want to drill through the metal. Then you need to have either a stock plastic tray or a customized plastic tray. Okay, just like this. So this is what a custom tray looks like. And just like in our denture fabrication, we make the special trays for doing the border molding and to capture the final impression. Same way, we take first the alginate impression of the mouth, where impression is going to be taken, and then you either send it to the lab and ask them to make a custom tray, or you can make it yourself as well. Okay, so once you have the custom tray made, you can take impression in that, so that will accurately record all the areas. Now, in which scenario would I want to make a custom tray? Do I make custom tray in every patient? No, absolutely not. And as far as we are concerned here, we are just dealing with the single implant basic cases right now, just one implant. For one implant prosthetics and impressions, you don't need to go all the way in making a custom tray. A standard plastic or metal stock tray would more than suffice. But let's say if you have an implant in a location which is too out of the ordinary, and you don't have normal trays which would fit that implant perfectly in your tray, or if you have done multiple implants and then it is difficult to manage all those implants in a stock tray that you have, then you might consider making a custom tray so there is no error in terms of impression taking. Because accurate impressions, as you all know, there is no shortcut to that. Accurate impression is the necessity for perfectly fitting crown, and perfectly fitting crown is paramount importance if you want your implants to be successful long term. Because placing the implant in the bone is one thing, and then having that implants in that particular implant in function, in chewing function for 10 plus years successfully without any problem, that is another thing. So when you are talking about the implant treatment, prosthetics is as important as placing the implant surgically. And for the most part, when we are starting out as beginners, we get anxious and nervous about the surgical placement too much, and then we tend to overlook or neglect the prosthetic phase. And actually, if you neglect the prosthetic phase, if you don't have your crowns proper, if you don't have occlusion proper, it could ruin, it could you could lose your perfectly osseointegrated implant as well. So occlusion and prosthetic is also very, very important. Never disregard that. Okay, so let's move ahead. So implant impressions are usually divided into two broad categories: the implant level impressions and the abutment level impressions. Implant level impression is further divided into either pickup or open tray impression, or transfer or closed tray impression. And the abutment level impressions are further divided into either direct technique or indirect technique. So we'll go and learn about each one of them in detail. That is going to be today's lecture. Okay, so let's start out. Okay, this is the small checklist. So before you schedule your patient for making an impression, you have to make sure you have the right kind of impression material, the trays, and also the parts. Okay, so never do such hasty work as patient just walks in, or you just call the patient without being prepared, because you don't want to be scrambling around and calling your friends or colleagues or implant reps for giving you the parts that you need, because that increases your anxiety, especially when you're doing for the first time. So make sure you have a checklist printed out and then stick it somewhere so you can see it, train your staff properly, and so you can arrange all the parts beforehand, before the patient comes. Okay, so it becomes a smooth, tension-free experience for you. Now, so you need to have your implant diameter handy. I mean, because the components that will fit inside the implant for impression taking will depend upon the diameter of your implant placed. Okay, so you will need various components. You will need to order those beforehand. So you have to make sure you know the diameter of the implant very, very well. So I don't know if we mentioned that earlier in the surgical lecture or not. That is why we always maintain a record of which all implants, which diameters have been placed in which patients. Remind me, I'll put a sheet, like a template sheet that I maintain in my clinic for all the implants that I have placed. Because when you place the implant, you let the patient go for about 3 to 4 months, then patient comes back. The time has passed. If you have not kept the record of which implant was placed in that particular patient's mouth, you'll be scrambling. I mean, you will never be able to guess the diameter from the x-ray correctly, and then you don't want to do that guesswork. So record keeping is really, really important in terms of implants. Okay, so make sure you have all the tools and all the components ready. Make a checklist and train your staff properly, so they are also prepared. Okay, so first we'll talk about the closed tray impression technique. Why it is called closed tray? As the name suggests, the tray is closed. That means we are not drilling any holes inside the tray. That means you can even use the metal stock tray or plastic stock tray in this case. For any impression taking, there are certain components common, okay, in any technique. One is called the impression post or impression coping. that this component right here, that goes inside the implant. And there's something called the impression or the implant analog, which is actually given to the lab person. So these are the two most important things that you have to keep in mind as far as the parts are concerned. One is the impression coping or the impression post. The other one is the implant analog. Now, as we move ahead, I'll tell you the difference between these two parts. Okay. So in the closed tray technique, what happens is, this is how you see the patient with the healing abutment in the mouth. So you take the implant hex, you remove the healing abutment from the patient's mouth, keep it in a safe Deppan dish dipped in a chlorhexidine or something. Okay. Then you place your impression post inside the implant. So since this is the closed tray technique, the impression post will be a little bit shorter. Okay, so now the impression post, let me describe about the impression post a little bit. So this is impression post or coping. It consists of two parts. One is the part that goes inside the implant. The other one is the screw that engages this part inside the implant. Okay, it has a screw. Let's see. So this is, as you can see, can you see the screw? And this is the part that goes inside the implant. And this is how it looks in the patient's mouth. This is how it is shown here, being tightened with the hex. Okay, so you place the impression coping and then you tighten the screw with the respective hex inside the implant. Then what do you do next? You always check the position of impression coping on the radiograph. This is the most important step. I cannot stress enough about this step. Now why? Because let's go back. This seems to be fitting perfectly fine in the picture right here, okay? And you feel that the screw was completely tight and everything looks fine. But the implant is placed a little bit, of course, subgingival, right? You're not able to see the junction between the implant, where the implant ends and the coping starts with your naked eye. You cannot see that. So you have to make sure you take a radiograph and verify. And look here, this is not correctly positioned coping. And how do I find that out? Because look at this, there is a small gap here between the impression post and the implant platform. There's a small minor gap. That means my post is not all the way sitting on top of the implant. Now what happens? Let's say if I don't take the radiograph, okay? If I don't check it, I feel clinically everything is fine. It feels tight when I close the screw in the implant and I just take the impression and send it to the lab. What will happen? What will happen is I will record the position at this level. So when my crown comes back, the crown will sit also exactly in the same position. No matter how hard you try, crown will not go down completely on the implant. So now you're creating a macro junction, not the micro junction, a huge gap at the junction between implant and crown. And we all know we don't like open margins, correct? Even when we do crown and bridge preparation, when we put crowns on the teeth, we don't like to put open margins. And why? Because marginal leakage happens. Bacteria tend to collect and it can lead to inflammation, bone loss and whatnot, and the tooth failure. Same thing happens here, and in implants it is even more devastating. If you don't take care of this gap, if you leave this gap like that, it will cause peri-implantitis or undue forces on the crown. It could have prosthetic failure. It could even have huge bone loss and implant failure. So this is really important factor. So you take, so in this radiograph, it is not sitting correctly. So then I have to reseat the coping, redo the radiograph, make sure now that it is sitting correctly. Now you can see it is completely flush. You cannot find out where the coping ends and the implant platform starts. This is how it should be. So once you verify that on X-ray, then you move ahead. Okay, so then what do you do? So you try the tray in your mouth, make sure the tray fits well. Then you take your impression material, whichever material you chose to use, follow the manufacturer's instructions as to how to use that material. Is it are you using the putty and wash kind of a material? Are you using the medium viscosity material, syringe material, whatever you're using, whichever way you're using? So then you squirt your material all the way around the coping. Make sure you don't leave any voids, and then cover each tooth on each side. to make sure you capture the contact details correctly and the contours of the gums and everything correctly. Then you seat your tray in the mouth in proper position, wait for the recommended setting time, and then remove the tray. Okay. Now, once you remove the tray, now this is called the closed tray technique. So you're taking an impression just like you're taking a crown and bridge impression. So once you remove the tray, the impression coping will still be in the patient's mouth as you had put earlier. Okay. So in this technique, it is prescribed that now you remove the impression post from the patient's mouth, you unscrew it, and then put it back in the slot in the impression tray where it belongs. Okay, as it is shown here, this slot is empty and this is where the impression coping has been placed. And this is the schematic diagram showing, see, so before you put that in, you will actually attach the impression coping with the implant analog. Now, as the name suggests, why? First of all, understand what is implant analog. It is also known as implant replica. That means implant you have placed in patient's mouth. The same implant copy, exact copy of that same implant, the Xerox copy of the same implant is called implant analog or replica. Why do you need that? Because you are going to give this impression to the lab, right? So lab has to have some reference. So you cannot remove the implant, of course, or you cannot give the new implant to the lab. Okay, take this implant and pour your impression. So you have to have something that works as an implant in the lab, in the stone cast. So that thing is called implant replica or analog. So then you attach the implant replica with the impression coping like this, one piece, and then you put that assembly in the slot. There is some indexing given on the impression post. So you have to make sure you put the impression post exactly in that same location and make sure it is lined up correctly. Now this is the only drawback that I see with the closed tray technique, that if you are not careful enough, now I hope you understand what I'm saying, when you have to replace the coping back in the impression. So you have placed the coping here in patient's mouth, okay, and it fits in a certain way, okay, and then you take the impression, you remove the impression tray, and then you try to fit the same impression coping that you removed from patient's mouth in the impression in the exact same way. And for you, for your guidance, the references are given, okay, the indexing has been given, so you just have to align all the notches properly. Now if there is some error in this alignment, your impression could be wrong, could be off by a few, even a fraction of a millimeter, that could cause some problem. So that is the only disadvantage I see with the closed tray impression technique. Okay, let's see. Okay, so this is a case description of closed tray impression technique, as you can see, and this discusses everything that I just talked about. So you are putting the impression post in the patient's mouth, you're taking the impression, you have the analog and impression post screwed together, and then you're putting it back in the impression, aligning it properly. Okay, so I hope you understand the closed tray technique now. Okay, so I already told you the limitation, okay, that if you cannot align the indexing properly, that could be some error in the impression. But usually it is, indication is, actually it is limited to single implant cases, or where there is limited interarch space. Then if it is a straightforward case, you can go ahead and definitely use the closed tray technique. The advantage is that it is really easy, really simple, and it can be done in pretty quickly once you get used to it. Disadvantages I already told you. From my perspective, it's just if you don't align the coping back into the impression properly, I mean, there could be some variations, and it is not suitable for deeply placed implants. Okay, why? Because when implants are placed deeply, um, when you put the impression coping back in the impression, that coping has to travel a lot of distance inside the material, and that could cause some dimensional instability. So so you don't want to use the closed tray technique for implants which are placed like 4 millimeter, 5 millimeter subgingival, it's better to have an open tray technique in that case. Okay. One more limitation is with this closed tray technique is if you're let's say if you're using for more than one implants, it's good if the implants are parallel, almost parallel. Then this technique is quite accurate. But if they are if there are no if parallelism is the issue, then it is better to use the open tray impression technique. Okay. All right. So now let's talk about the open tray technique. Okay. Why it is called open tray? Because you are going to drill a hole through the impression tray, and you're going to retrieve the screw of the impression coping, and we'll learn as we go along. So in open tray impression technique, what happens? The first step is the same, of course. You remove the healing abutment from the implant and you place the open tray impression coping in place. You tighten the screw. Now, if you notice here, open tray impression coping pretty much looks like same as the closed tray. The only difference, if you notice, the screw that holds the coping in place on implant is longer in open tray. And you will see why. Okay. Then again, you verify the proper seat of the impression coping. You see in this X-ray, there is the first impression coping is not seated perfectly. There is a gap. And in the second one, they retried it and now it is sitting correctly. So very important step. Doesn't matter it is open tray, closed tray, single implant, multiple implant, I don't care. You have to verify it. Once you put the impression coping, you have to verify it on the X-ray. Okay, now see, this is how it happens. This is why it is called open tray. Okay, you somewhat drill a hole. This is the stock tray, this is custom tray. You're drilling a hole at the proposed site of the implant where the impression coping has been placed, and that impression coping is sticking out through the through the impression tray. Then why do we do that? Because as the name suggests, this is open tray technique. So that means that once you put the impression material around the coping, you will remove the screw before you remove the tray. So you will pick the impression coping in your impression. That's why it's called pickup impression. Okay. So again, you'll do the same thing, inject the material around the coping and on the each one tooth on each side of the implant. Make sure you correct, there is no air bubble. Make sure you cover buccal, lingual, mesial, distal, all areas thoroughly with the impression material. Seat the tray in mouth, wait for the prescribed period of time before you remove the tray. Now be very careful here. Before you remove the impression tray from patient's mouth, remove the impression coping screw. Okay, just the screw which is holding the impression coping in mouth. Okay, just remove the screw. So when you take out the impression tray, the coping will be picked up in the impression. So you don't have to replace it back. You see the advantage? Okay, so this is again the illustrated diagram to make it more explanatory to you. Hopefully you are understanding this. So you're removing the healing abutment, you are trying the tray in the mouth, you are injecting the material, placing the tray, allowing the material to set. You are removing the screw, and the impression copings are being picked up. Okay. So what are the indications? Now, open tray impression technique actually is my favorite impression technique. All of my cases, either single one, multiple one, I don't care. Any implant that I place, I have been doing open tray impression technique only in my practice. Sometimes in certain cases I do closed tray impression technique. The only cases I do closed tray impression technique is when patients cannot open too much. Okay, and the implants are placed far back, like in upper 7 or lower 7. Patient has limited mouth opening. Because what happens is in open tray technique, you need to have patient to open quite wide, because you have to fit the impression coping, which has the long screw. Then you have to fit the impression tray on top of it. And then you have to fit your hands and your hex to remove the screw of the coping before you remove the tray. So your patient has to open enough for you to do all that stuff. And most of the patients can open that much. That I have never seen that much of a problem. Only in limited scenarios I have used closed tray impression technique, because I believe open tray is more accurate, because it takes away the burden on from your shoulders to replace the coping back into the impression. Okay, so that is the advantage. Let's say if you have done multiple implants and if the parallelism is not maintained that well, open tray technique works well, then closed tray wouldn't work. Or if an implant is placed far too deep under under the gum line, of course open tray would be best choice. Or if you want to customize your implants in certain way, open tray impression is actually a better choice. As I said earlier, in limited mouth openings and difficult to reach areas, closed tray works fine. That doesn't mean that you should not use closed tray technique. It's just in certain individuals' hands, closed tray works better. I think in my hands, open tray works better. All right. Okay. So, we talked about the implant level impressions. Now we talk about the abutment level impressions. So there are two techniques for abutment level impression. One is the indirect technique, and the other one is the direct technique. Um, this is the technique, indirect technique, where what are the steps involved here? So first of all, before I go ahead into the depth of the abutment level impressions, let me just tell you the difference here. So we talked about implant level impressions. Okay, so we are recording the position of implant in the impression. That is why they call implant level impressions. These are abutment level impressions. That means they are pretty much recording the implant abutment junction. Both together are being recorded, not just the implant itself. Okay, that is the difference here. Now, there are two techniques, indirect and direct. In indirect, what you do is, whatever abutment you have selected, you place the direct abutment. So here there is no impression coping involved. See, that's another difference. So you choose the abutment. Okay, now how to choose the abutment, again, that will follow in the next lecture. As I told you, it's prosthetics is quite vast. So I will in the next lecture show you how to choose abutment and what kind of processes to make, what to write in your script for lab as to what kind of prosthesis you want to make, screw retain or cement retain and whatnot. So that we will discuss in the next lecture. For the impression part, today what we are concerned is what is this indirect abutment level impression technique. So what you do is, rather than putting the impression coping, you are putting an abutment on the implant. You will screw in the abutment, you will tighten the abutment, and then you will put some components on top of the abutment. Okay. Here again, the picture, the healing abutment is removed, and this is the final abutment. It's called, if you're using a Nobel Biocare implant, it's called snappy abutment. So you're putting a snappy abutment, you're tightening the screw, again you're verifying, even if it is abutment, it's not impression coping, still you have to verify it on the X-ray to make sure it is seated correctly, there is no gap. So you verified that, you are okay, you move ahead. Then you put something called a basket. That's why it's called snappy abutment, because this basket that is provided that snaps on to the abutment. Now, as you see, there's a kind of a niche or a ditch given here on the abutment, and the same corresponds on the plastic basket. So you fit those and snap the basket on top of the abutment, and then you inject the material around that basket. So and you load your tray, and then when you remove the tray from patient's mouth, this basket would be picked up in the impression. Okay, so in a way that is giving the lab information about the surface of the implant. Okay, so implant stays in the patient's mouth. That is why it is called indirect technique. That implant stays in the patient's mouth, and then see, this basket is being picked up in the impression, correct? And then you put abutment replica. Okay, so the abutment in the patient mouth, it gets covered with the healing cap, so the abutment, final abutment doesn't get damaged. Okay, and what gets sent to the lab is the abutment replica, which is the copy of this abutment that you have placed in patient's mouth. Similar to that, Xerox copy of abutment will sit in the impression. Let me show you again one more time. In this basket, okay, when this impression goes to the lab will put something in here first. what will they put is abutment replica, and then they will pour the model. So once they pour the model, they will see the abutment replica on the cast versus what they were seeing was implant platform in implant level impressions. I hope it is clear because this is a little bit confusing when you get to know this for the first time. This is abutment level impression. Okay, so here see, I'm not trying to record the implant position because I'm already placing the abutment, and I'm trying to record the abutment position in relation to gums. You see, that is the difference. That's why it's called abutment level impression. Okay, so then this illustration explains a little bit better. So once you pick up the impression from patient's mouth, you see this instrument is holding something called abutment replica. So that is being replaced in the impression right there, and then they are putting some gum for mimicking of the gum. They put the pink material. We don't know, whatever it might be. These are some lab steps, and then the impression is being poured in stone, and this is how it looks like when it is poured up. Okay, with the abutment replica, and then lab will form just the crown on top of it. Now you see the difference. In the previous techniques and the implant level techniques, lab will not have this abutment thing popping out on the cast. They will have just the implant level information. Then you will select the abutment. Here you have already selected the abutment and given that information to the lab to make the crown. So this is actually simpler technique. So that was the indirect technique. Now we talk about the last technique, which is the direct technique. This is pretty much like a crown and bridge impression. I don't recommend, I mean, this is the least of all the techniques that I would recommend. Okay. So here what you do is you place the abutment. Of course, you verify the position on the x-ray. If you have to modify abutment in certain ways, you do it. You give the margin, you do it in mouth. Actually, just like you do prepare for a crown, and then just like you make an impression, just make an impression, and then try in your prosthesis and cement the crown. Okay, so that is why it's called direct technique. All right, so what all we talked about. So what was the armamentarium that you will need? So first we discussed the impression material. Okay, the choice of material, the tools that you will need to remove healing abutment and placing of the impression copings or abutments. Then you will need all the impression armamentarium, which is the closed tray impression coping, open tray impression coping, implant replica, snappy abutments, snappy abutment baskets, and then the abutment replica and all the trays, of course. So this is all the armamentarium that you require for impression taking. So this is the closed tray impression coping. As you can see, the screw is smaller. This is the open tray impression coping. The screw is longer. This is the abutment, the implant replica. Okay. So as you go along, I know this might be a little bit overwhelming to kind of understand what is replica, what is implant replica, what is abutment replica. So I'm sure you'll have questions after listening to this lecture, and I'm here to answer all the questions that you might have. So if you require, just go over the lecture one more time, ask any questions, email me, WhatsApp me with any questions that you might have, and I'm sure when we do the procedure on patients, it will all get cleared up. Okay, so in conclusion, precise impression methodology has to be there for the successful restoration. It doesn't matter whichever technique you use. Okay, pretty much all the techniques are they give the same result if you follow the protocol well. Okay, so it doesn't matter, whatever is your convenient way of doing impressions, do it, but you have to have an accurate impression material to record the impression properly, and then go ahead and make your prosthesis last longer. All right, so as I said earlier, in the next lecture we'll talk about how to choose the abutment, the final abutment, and what to talk to the lab, what instructions to give, how to choose the restoration type, which is cement retained versus screw retained, how to do trials, what are the lab steps, and what will you get, what you have to do until you have your final crown delivered, and the occlusion, of course. Okay. All right, I thank you so much for bearing with me, staying here, going through the lecture, and you all know how to contact me if you have any doubt. I'll be more than happy to answer any of the questions that you might have. Thank you so much, and good night until we meet again. All right.